Reading chest X-rays has been always very easy and simple if you understand the basic findings. So this is a right lower lobe pulmonary tuberculosis, and in this X-ray we see a pleural effusion or fluid. Now let's discuss about normal chest X-ray. Chest X-ray is nothing but an X-ray beam passing through the chest either posteriorly or anteriorly, and dependingly it is called as PA view, posterior anterior view, or AP view. AP view means antero posterior view. What is the difference? The X-ray radiations are passed from posterior to anterior in PA view, generally in a standing X-ray. This is the most commonest X-ray, chest X-ray, and this is the commonest position, PA view. Generally, AP view is being taken in X-rays for patients those who are bedbound, bedside X-ray, or patients who are not able to stand. In a normal chest X-ray, you will be finding the clavicles, bilateral lung lobes, the heart shadow, cardiothoracic ratio. The heart should occupy only 50% of the chest X-ray. In this first chest X-ray, we will be seeing about pulmonary tuberculosis. In this X-ray, you are seeing about the right upper lobe being affected by pulmonary tuberculosis. How will pulmonary tuberculosis see in a chest X-ray? It will look like fibrosis, consolidation. Fibrosis, consolidation, or any infective sequelae will look like white cloudy appearance in the background of the chest X-ray. So we need to differentiate between consolidation, fibrosis, and tuberculosis. In pulmonary tuberculosis, additional to the white patches, we will also be seeing about the cavity lesions. What are all the clinical findings of pulmonary tuberculosis? Evening rise of temperature associated with chills and rigors, loss of weight, loss of appetite, cough more than 2 weeks associated with expectoration. What are all the other tests being taken? MAN2 test and sputum for AFB, acid fast bacilli, and in current trend, sputum for gene expert is considered to be the gold standard for the diagnosis of pulmonary tuberculosis. Pulmonary tuberculosis is common in malnourished people. Either malnourished means it is not always the underweight patients. It is happening both in underweight patients and overweight patients. Properly nourished means the BMI. Properly nourished patients means body mass index between 18 to 23. BMI less than 18 or BMI more than 23, that is in lean, very lean individuals and very obese individuals, tuberculosis is very common. Why? Because whenever there is poor nourishment, either under or overnourishment, the body's immune mechanism gets failed or deteriorated. Pulmonary tuberculosis is a common infective sequelae happening in the environment. In that case, we call it as latent tuberculosis. For those who are immunocompromised, patients end up with pulmonary tuberculosis. In this X-ray, we are seeing in the right lower lobe pulmonary tuberculosis. Yes, let's discuss about the next commonest finding, pleural effusion. In India, 3 common causes of pleural effusion are tuberculosis, tuberculosis, tuberculosis. In this lobe, in this chest X-ray, you can see the right lobe, you can see the air fluid level. So fluid in the thorax is seen as white entire fullness happening in the lung. The fluid in the lung can be a pleural effusion, it can be chyle, or it can be pus. So dependingly it is called as pleural effusion, chylothorax, or hydrothorax, or pyothorax dependingly. So the gold standard treatment for pleural effusion and pyothorax is to find out the underlying pathology, and if required it needs ultrasounded or clinical drainage, or in required it needs intercostal drainage. Hence, majority of the chest infections in India we commonly see as pulmonary tuberculosis. The next common finding is pneumonitis, and the end stage of pneumonitis we see fibrotic bands, consolidation. Hence, we need to be very precise and accurate about the treatment of tuberculosis. In India, tuberculosis treatment consists of intensive phase and continuation phase. Intensive phase takes care of the drugs of H or ZE, rifampicin, isoniazid, pyrazinamide, ethambutol in the intensive phase. In the continuation phase, the pyrazinamide is eliminated and you have only H or E, rifampicin, isoniazid and ethambutol. Tuberculosis is a fatal diagnosis if not treated adequately, and any relapse of the drugs, if we leave the drugs and restart, it can end in multi-drug resistant tuberculosis. Tuberculosis is very common in developing countries. Hence, let's stop TB, fight TB.